What is evidence-based practice? Evidence-based practice is a smart way of making healthcare decisions. It means not treating patients just because this is how it has always been done. Instead, healthcare professionals use the best information available at that moment. Evidence-based practice connects science, real-life clinical experience, and the patient's own choices to guide care in the right direction. Think of evidence-based practice as a balance. On one side, there is research that tells us which treatments work best. On the other side, there is the clinician's hands-on experience, gained from treating many patients over time. Right in the center is the patient, with their values, concerns, lifestyle, and expectations. When all three come together, care becomes safer, more effective, and more personal. Evidence-based practice helps healthcare workers move away from guessing and routine habits. It encourages them to ask questions, look for evidence, and choose treatments that are supported by research and suitable for the patient. This not only improves health outcomes but also builds trust, because patients feel heard and involved in their care. Main parts of evidence-based practice, EBP. The first pillar is research evidence. This comes from scientific studies that test treatments and approaches. It tells us what works, what doesn't, and what might even be harmful. Examples include randomized controlled trials, systematic reviews, cohort studies, and clinical guidelines. Clinicians access this evidence through databases like PubMed, Cochrane Library, or professional journals. This evidence answers the question, what has been proven to work? The second part is clinical expertise. This is the knowledge and skills gained from years of training and caring for patients. It helps clinicians apply research to real-life situations. For example, a therapist might use their experience to adjust an exercise program for a patient with knee pain. Clinicians develop expertise by practicing, attending workshops, learning from mentors, and reflecting on patient outcomes. The third part is patient values and circumstances. This includes the patient's preferences, beliefs, lifestyle, and daily responsibilities. For example, a patient may prefer home exercises over clinic visits or may have cultural beliefs that affect treatment choices. Clinicians gather this information by talking to patients, asking questions, and listening carefully. Steps of evidence-based practice. Step 1. Ask a focused clinical question. Formulate a precise, answerable question that targets the patient's condition. Use frameworks like PICO, patient or population, intervention, comparison, outcome, or SPIDER for qualitative questions. You can watch the linked video above to learn how to create a PICO question. Identify the type of question. Questions usually fall into categories such as therapy or intervention, what treatment works, diagnosis or screening, how can we accurately identify a condition, prognosis, what is the likely course of the disease, causation or etiology, what factors cause the condition, or prevention, how can we reduce risk or prevent the disease. Knowing the type of question focuses your search strategy and ensures that the evidence you gather is relevant and applicable to the patient's situation. For example, if a patient has early-stage osteoarthritis, a therapy question might be, does structured physiotherapy reduce knee pain better than standard home exercises? This guides you to look for intervention studies or clinical trials rather than studies on disease causes or prevention. Step 2. Acquire the best evidence. You can watch the linked videos above to learn how to search for the best evidence. Search systematically for evidence using databases such as PubMed, Cochrane Library, Embase, and specialty-specific journals. Include systematic reviews, RCTs, cohort studies, case control studies, and clinical guidelines. Use defined keywords, Boolean operators, and limits like publication date, language, or study design to narrow results. Don't ignore gray literature, theses, conference papers, institutional reports, or clinical expertise from colleagues. You need to understand the levels of evidence and types of research to find the best evidence. Watch the linked video above to learn more. Collect multiple high-quality sources that directly address your clinical question. Step 3. Critically appraise the evidence. You can watch the linked video above to learn how to critically appraise evidence using AI tools. Assess each study for validity, reliability, bias, and applicability. Check study design, sample size, statistical analysis, and outcome measures. Use standardized critical appraisal tools, like CASP checklists for RCTs, cohort studies, and qualitative studies. Evaluate whether results are statistically significant and clinically meaningful. Decide if the evidence is strong enough to inform patient care, or if more research is needed. Step 4. Apply the evidence. Take the studies and data you have critically appraised and combine them with your clinical expertise and the patient's values, goals, and daily life context. Assess whether the recommended interventions are practical in your setting. For example, do you have the equipment, time, and staff to implement the therapy? Evaluate risks and benefits for this particular patient. Tailor the treatment by considering age, comorbidities, mobility, lifestyle, or cultural beliefs. For instance, if research shows that high-intensity exercise improves knee pain, but your patient is elderly with heart disease, you might modify the program to low-impact exercises that are safer yet still effective. This step ensures that research is not applied in isolation but converted into safe, individualized, and achievable care. Step 5. Evaluate and audit outcomes. After applying a treatment, carefully measure the patient's outcomes using validated tools, scales, or clinical indicators relevant to the condition. For example, use a pain scale, range of motion measurement, or functional assessment to track progress. Compare these results to the expected benchmarks from research or clinical guidelines. Reflect on questions such as, did the patient's condition improve as anticipated? Were there any side effects, complications, or barriers to progress? Document all findings clearly and analyze what worked and what could be improved. Use this information to adjust future care, refine protocols, and share insights with colleagues through team meetings, case discussions, or professional presentations, ensuring continuous improvement in evidence-based practice. Implementation strategies for evidence-based practice. Create awareness and interest. Inform staff about new evidence and guidelines through meetings, emails, or short training sessions, so they understand why change is needed. For example, introducing new fall prevention guidelines during a staff briefing. Build knowledge and commitment. Train clinicians on how to use the evidence in daily practice and explain the benefits for patient care. For example, teaching nurses how a new wound care protocol improves healing. Promote action and adoption. Make it easy to use evidence by adding guidelines into routines, checklists, or electronic health records. For example, automatic reminders for evidence-based screening tests. Integrate into daily practice. Embed evidence-based steps into standard operating procedures so they become routine. For example, making pain assessment tools a required part of every patient assessment. Support sustainability, monitor outcomes, provide feedback, and update practices regularly to keep EBP active long-term. For example, reviewing patient outcomes every few months and adjusting protocols as needed. The problem with EBP, evidence-based practice, has many benefits, but it also has some problems. Sometimes the label evidence-based is used by companies or groups to promote their own products, even when the benefit is small, such as a new drug marketed as superior with very little real improvement. There is also too much evidence and too many guidelines, which makes it hard for clinicians to keep up. Some treatments show good results in statistics but make only a small difference in real patients, like a medication that lowers pain scores slightly but does not improve daily function. Strict rules and computer alerts can push clinicians to follow protocols instead of focusing on the individual patient, such as automated reminders that ignore patient preferences. Many guidelines work well for one disease but do not fit patients with multiple conditions, like an elderly patient with diabetes, heart disease, and arthritis, where following all guidelines at once may cause harm.